Good day, citizens of the free world. From border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. Our mission is simple: searching for beneficial disruption in healthcare from emerging technologies. My guest today is Dr. David Koepsell. He's the CEO and co-founder of EncypGen. He has a background in law and ethics and has authored numerous books and articles on genes as well as the ownership of personal data. David brings his interests and expertise together to guide the development of systems to enhance the value of genomic databases while also protecting donors and making them stakeholders. David, thanks for joining us on the Tate Chronicles.
Thank you. It's a pleasure.
I've really been looking forward to this. But before we jump in the discussion, there's something I ran across this morning that I'd like to read, kind of a news thing. And it says that this summer, the pharma giant GlaxoSmithKline made a $300 million investment in 23andMe for the purpose of developing new drugs based on specific genetic mutation. Seems like this was a win for GlaxoSmithKline, and for 23andMe, probably not a win, even if they were aware of it, for those who actually provided their DNA. So this seemed like it might be relevant to our conversation. And it seems like, what you're involved is the concept of really incentivizing patients, or not even patients, just incentivizing humans to allow use of their depersonalized health data, in this case DNA. It's relatively new. What brought you into this, and how is it structured in EncypGen? Just give us a little background, please, Dave.
Sure, absolutely. So, let's talk about the GSK deal shortly, but let me give you a little background about how we started what we're doing. I've been involved in issues of ethics and genomics for more than a decade. I did a postdoc at Yale in 2006 at the Bioethics Institute there, and wrote a book that came out in 2009, and that book was called Who Owns You? And in that book, I was looking at the then practice of patenting genes, and I had argued in my book that gene patents were unethical and contrary to the principles behind patent. Shortly after that book came out in May of 2009, the ACLU brought a lawsuit against Myriad, you may recall, and it concluded with a rather stunning victory for the side I had argued for, where genes shouldn't be patented because they were parts of nature; they were not man-made. So that left, and I should say my wife, who is Dr. Vanessa Gonzalez and co-founder of EncypGen, is a genomic scientist, and she and I have collaborated on these issues for some time. So we then turned our thoughts to questions of privacy in genes. So if you can't patent a gene, how are you going to protect people in that genetic information? They can't claim ownership over it in any way, but surely there's some way or some manner in which they have a right to the data that's in their genes. So we'd written some articles together. There was in 2014, Dr. George Church, who you've probably heard of, he's in the genomic space as well at Harvard. He had said in an interview in I think it was the LA Times, that people were just going to have to get used to the fact that, when you use your data in science, it's possible you're going to be identified. So you shouldn't necessarily expect to be private, and you should just get used to that. And we concluded that that's actually a problem, and that's something that we should probably look at solving in some way. And Vanessa and I had written a couple of chapters and papers on the issue of privacy and genomic big data. And meanwhile, in a sort of separate track, I was interested in blockchains from my background as a philosopher, as an ontologist. And, I'm interested in how data exists in blockchains, and I was interested in what those things are, and we realized there's a real synergy there, and we could probably actually make something that could solve some of the problems of privacy in genes and ownership of genes by using blockchain. That launched us in an entirely new direction, where we started a company and got to work on building what we are now calling the gene chain.
And when was the company founded?
We started in December of 2016. We got our first funding in January and February of 2017. We had a prototype in hand by the time of the BioIT World Conference in Boston in June of May of 2017.
Well, and so let me, there's really two paths here I want to pursue in discussion with you, Dave. One is the overarching, I guess, philosophical or policy issues related to. I signed up and had sent in my spit sample to Ancestry.com a couple of years ago, and very, very fascinating. I didn't realize that part of in the small print was that genetic data could be sold.
Right.
And so is that, and it is possible with these commercial testing and analysis companies, it is possible to opt out, but it can be very difficult to opt out of your data being used for really their business purposes.
Right. Yeah. So I think that's the situation a lot of people who are using these consumer testing companies are finding themselves in. They didn't fully realize, or they didn't wholly appreciate the nature of the relationship that they were entering into. And that data, the data is still yours, but you basically, when you do these tests, you license over to them the ability to sell it, and that's exactly what's been going on. So if we can talk about the numbers right now, it's really kind of interesting.
Sure.
And I should say that, from a scientific perspective, all of this is really helpful because now there's millions of new data sets that can be used in the basic research that is so vital and necessary in genomics and pharmaceutical sciences. But there's been a trade-off, as we found in the Facebook Cambridge Analytica case. That the trade-off many of us have been making for quite a long time now that we've been using the internet between using services and our privacy is rather significant. A lot of us have a lot of data out there now that's being used profitably by other companies that we really didn't appreciate the extent of which we were making that bargain. So if we get into the numbers, 23andMe has now more than 5 million customers who have done tests with them, and according to their own figures, 80% of those people have agreed to allow their data to be used for science. That means basically that 23andMe has been selling that data. And again, according to their figures, each person who's made that agreement has had their data used about 200 times already. That's a significant amount of
it really
contribution. Yeah, and that data is being bought for a lot of money, it turns out. And now we can circle back to the GSK deal. If GSK is willing to invest $300 million to have this exclusive relationship where they get data from 23andMe, you can imagine how valuable each person's data ends up being when aggregated and sold to these companies.
Are there groups beyond pharmaceutical companies who access this data from these consumer things? This pharmaceutical research. Is any academic research involved in the use of this data and selling of this data? Are you aware of any of that?
Certainly there is. And it's not just pharmaceutical companies, obviously, but academic research, basic research in institutes and hospitals has been bolstered by access to these sorts of databases too. But that access is not free. They pay for it.
There's it kind of harkens back to a book I read a couple of years ago, and maybe you can help me remember the title. It had to do with a woman, probably in the 1940s or 50s, who went to Johns Hopkins and had cervical Harriet was her first name.
Yeah, Harriet Lacks.
Exactly, and how the use of her cells has been monetized for perhaps 50 years or longer. with no benefit to her or her heirs whatsoever. So this is still, to me, philosophically, still in that vein. And so, how does EncypGen's gene chain work? If I wanted to submit my DNA data to your company and allow it to be monetized, and I become part of that circle for the first time, how does it actually work? Do I submit just the data to you that maybe I got from one of the commercial consumer testing agencies, companies?
Yeah, it's quite simple actually. So we wanted to be able to provide scientists with a free market to search for data and consumers the same access, so that they could upload their data easily and see if other people are interested in using it in science, and then also pay them directly. So we have what's called My Gene Chain, where anybody who has a file from one of these testing services. Right now, we're using 23andMe, Helix, and Ancestry type files. Can upload that data and create a profile and set a price for that data in our native token, which is a cryptocurrency called DNA. So all you need to do, and we have some instructional videos on how to do this on our site, is go to either your 23andMe profile or Ancestry or Helix profile online and choose to download your raw data file. And all of those services let you do that. And then you simply create your profile on our site, which is at EncypGen.com. The site for My Gene Chain is my.EncypGen.com. And then you create a profile and upload the data. So actually, it's the profile data that makes the genomic data so valuable, and that's something that is part of the genius of what 23andMe has done. If you do 23andMe, they ask you to do all of this questionnaires, all of these questionnaires about your health, behaviors, demographics, physical characteristics. And it's really all of that. And you don't have to do that to get a report from 23andMe that you can understand. Rather, when you do that information, what you're doing is you're bringing a tremendous amount of value to your genomic data for them to be able to allow pharmaceutical companies and researchers to search among those characteristics to find files that they're interested in using. So on our profile, you also do the same thing. You fill in some physical, demographic, behavioral, and medical data, and that's what's going to bring value to researchers in searching for and using it.
And then how does and I intend to upload my file this afternoon. So
okay, great.
Dave, be on the lookout for it.
But we can't tell if it's used, but we'll
I know that. But how does your cryptocurrency token DNA? How is that worked as far as you say the submitter sets a price, or how does that work?
Yeah, when you create your profile and upload your file, you set a price for it. And you can use as basic guidelines the sort of numbers that we've been talking about. So when people ask me, well, how much is my DNA worth? Well, my response is, figure out some price underneath the cost of the test, and assume that it's going to be used more than once, and then you can set a price based on that. So our cryptocurrency DNA is ERC20 token. It's widely available and easy to use. You can store it in your MyEther wallet or other ERC20 wallet, or Trezors allow you to store them as well. And then when you create your profile and when people start to buy data on our platform, your wallet on the platform will start to receive those tokens as your file gets sold. And then right now the token isn't worth terribly much, so you may want to accumulate it for a while. You may want to always accumulate it and see if the price ever goes up, but you can also cash it out in any of the various exchanges. Researchers are going to have access to it through the same mechanisms through the various exchanges that host it. And we expect there to be eventually an economy, basically, in which the DNA token represents the value of genomic data, and people, view it as such.
Sure. And so when researchers come, and do they go through some type of search protocol? Says everybody with DNA has type 2 diabetes. I want that DNA data. Do they do that?
Right.
Do they do selective? I see. And so,
Yep.
And then do they pay with the DNA token?
Yes, they do. The entire economy of the platform is with that token.
Okay, great. In my research and looking at many companies who've used the token, in many cases the token really seems to have no functional value other than it was a way to raise money without giving up equity. In your case, the token seems to be an actual integral part of the process, so it makes sense that a token would be involved there.
Well, we think so, and one of the reasons is because most research projects and a lot of good research occurs across borders and throughout the world, and having fiat gateways using fiat currencies is very expensive for a lot of people. PayPal and others take a pretty hefty percentage of the transaction fees. And we wanted to make it a lot easier for researchers to be able to do the research and not have to worry about conversions into their local fiat currencies. And so using a single currency on our marketplace, which is what it is, just makes sense.
Where are you in the entire trajectory? Are you set up and are researchers able to come in today and purchase with a token and get DNA data, de-identified data?
Almost. So researchers now can search and see how many results they're going to come up with. The buy button is coming within the next 30 days. So we're nearly there. The payment platform that we've created, which is a unique blockchain for our token, is built and it's in testing, and we're about to release it in the next 30 days. So once that's online, the first such transactions are able to be completed. But for now, they can search and see how much data is up there and whether they'll be interested in buying it in the next 30 days.
I've got a question for you based on your background and obvious interest in privacy. For any of these platforms that arise that have de-identified data, I can see why it could be used for research, but I can also see the potential where a company might want to, a marketing company might want to search for hotspots of diabetes by zip code so they know where to market.
Right.
And so what are your thoughts about that? Is that an issue at all, or is that just part of the game? Because is the DNA used for anything beyond research? You may not even know. Yeah.
No, it could be. And as we know, these various consumer databases and public sites have been used by law enforcement even to find suspects in cases that have long been cold.
Sure.
So we don't want to be that kind of platform. We want to make sure that the focus is on science and individual healthcare. So we don't allow that kind of specificity in searching, not down to a zip code. That may come at some point if researchers and scientists find a use for that. But right now we're more interested in preserving anonymity and privacy for individuals than in serving those sorts of needs.
So the whole concept of patients, we're calling these folks like myself patients, even though we're not patients, but we're providers of our health information, being incentivized. And there's a move that there could be incentives based on wellness and health outcomes. If I have a high BMI and over time it drops down, I could be incentivized with some type of token. Are you thinking ever about getting on that side of the coin at all, or are you pretty much staying on the DNA data?
Well, I think actually that's going to be a natural consequence of personal genomics. So there's a lot of value in personalized medicine, which healthcare providers are, I think, going to realize in part through the use of genomics. So one of the uses we foresee is for you to be able to share your data with your personal physician or genetic counselor, and to use that to actually treat you better, to provide more targeted health care. Because, for instance, we already know that certain drugs and certain treatments are better suited to different genetic profiles. So we can foresee in the near future the use of this sort of service for improving your personal health care. And we are partnering with a couple of companies that are also blockchain healthcare companies like HealthWiz and Emrify, who are personal healthcare record companies, to be able to deliver the genomics portion of your electronic medical record using our system, our platform, and their platforms in tandem.
And your structure, your design, the functionality of the model that you're doing really could not be done without using blockchain and a cryptocurrency underneath it, could it? I mean, it really...
No, it really couldn't. If we tried to do this using fiat gateways that are available, it would really be just far too expensive and far too clunky.
And that's what fascinates me about blockchain. There's so many use cases out there that really are not good use cases. This is an example of how blockchain allows something to be done that otherwise really would not be done.
I think so, yeah. My only concern is that it's still sort of difficult for ordinary people to get a grasp of and to use many of the tools. So I'm hoping that over time, as people become more comfortable and as we make our tools more accessible, it'll become a lot easier for people in general to use these sorts of services.
And so when you're talking about tools, you mean wallets for storing tokens or tools for... Yeah, okay, yeah, exactly right. And, one of my relatives asked me the other day, what's all this, stuff? And I say, well, you're already using electronic money right now. So this maybe is just a one-off of that. Everybody's used to using electronic money. You mentioned the token. Is your platform Ethereum? Is that the platform?
No, actually. So we did look at using Ethereum early on, but we were concerned, as many have been concerned, about its scalability issues and traffic on. I mean, CryptoKitties really sort of exposed for us some of the dangers of using the Ethereum platform for serious business. Hopefully, the modifications and changes to the platform will prevent that from being a real problem. But we decided early to use multi-chain, which is a creation of a company called Coin Sciences Limited, founded by Dr. Gideon Greenspan. And it's an analog, basically, of the Bitcoin network, but it's really meant for permissioned blockchains, which is a special type of blockchain where only certain members that you qualify are able to become part of that network. And multi-chain has proven to be pretty versatile for us, and the platform itself, where we're storing and accessing information for the blockchain is on multi-chain. But the token is an ERC20 token, so that presented some challenges and opportunities for us in building our system.
Yeah. So it's a private blockchain, then, sounds like, that you run on top of.
It is. Yeah.
Yeah. Okay.
There's a number of reasons we chose to do that. One, it turns out, is because the GDPR rules in Europe have required anybody who is storing personal information to be able to allow people to delete that information. Now, blockchains are not meant to do that. So you have to design your platform now such that anytime you're storing re-identifiable information, there's a way for them to be able to users to be able to delete that. And so it turned out that not using the Ethereum platform was helpful in that regard.
I'm shocked that our time has flown by. We are totally out of time. I know, it's unbelievable. Let me just kind of speak to our audience for just a minute here. Thanks for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Dr. David Koepsell. You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors. Thanks so much, Dave.
Thank you.